Good day everyone, my name is Leah Denise D. Diamante. So now I am going to perform parenteral medication via intramuscular, subcutaneous, and intradermal return demonstration. So first, we will going to prepare all the materials. So I am going to use sterile water, 3 syringe, 1 insulin syringe, 1 cc, and 26G needle. So I have also dry cotton and wet cotton, and I have a tray, a notepad, and a pen, and a sharp bin, and a gloves. So first we will check the doctor's order and the medication administration record or MAR. So we can check the drug name, dosage, frequency, route of the administration, and expiration date of the administering the and expiration date for administering the medication. After checking the doctor's order and the MAR, so we will organize the equipment. So after that, we will prepare the medication. So first, we will perform hand hygiene. So to prevent the spread of microorganisms, we will use first the filtered needle before using the regular needle. So draw an amount of air, the same amount of the needed medication, and flip your and draw the needed and get the bubbles. And get the filtered needle and put the regular needle. Next, we will list down the name of the medication and the amount of the dosage of it, and put beside a note beside the medication, so you won't forget the medication that will be given to the patient. So ma'am, as we started our medication, the medication will produce a small wheel, as sometimes we call it a bleed. A wheel is a small raised area like a blister, and you will feel slight prick while the needle is entering your skin. Is that okay, ma'am?
It is okay with me.
Provides a client's privacy and select and cleanse the site. Avoid the sites that are tender, inflamed, or swollen, and those have lesion. So while we're waiting for the antiseptic to dry, we will remove the needle cap. Expel any bubbles from syringe. Grasp the syringe in your dominant hand and inject the fluid. With a non-dominant hand, pull the skin and insert the tip of the needle far enough to place the needle through the epidermis into the dermis. stabilizes the syringe and needle. Inject the medication carefully and slowly so that it produces a small wheel on the skin. Withdraw a needle quickly at the same angle in which it was inserted. Activate the needle safety device. Apply a bandage if indicated. Do not massage the area and encircle the surface. And write down in the plaster the medication, the dosage that you use, and the time that you injected the medication. And wait for 15 to 30 minutes if there's a red spot or hardening in the injected area. Remove and discard the gloves from hand hygiene. Circle the injection site with ink and observe the redness or induration per agency policy. After observing the patient, document if the client had a positive or negative skin result, and follow the labeling of the allergies. Now I am going to perform intramuscular administration. So the same with the intradermal administration. We will check the doctor's order and check the medication administration record, and so check the label of the medication carefully against the EMR to sure that the correct medication is being prepared. So also check for administering medication and read the label of the medication when it's taken from its medical cart before withdrawing the medication and after withdrawing the medication. After that, organize the equipment. After that, we will perform hand hygiene and provide the client's privacy. So prior to performing the procedure, introduce yourself to the patient and verify the client's identity using their names and date of birth. So, hi ma'am, I'm Leia Denise T. Diamante from Davao Doctors College. I am your student nurse for today. So I am going to perform intramuscular medication to you. Can you state your name, ma'am? Your date of birth? Okay, thank you, ma'am. So after that, assist the client to its comfortable position, depending on the site that where to be given the medication. If the client is uncooperative, ask for assistance so they can hold the client for a better procedure. So locate the exact site for injection, apply clean gloves, and clean the site with antiseptic swab using a circular motion. Prepare the syringe for injection. Remove the needle cover and discard without contaminating the needle. Inject the medication using the Z-trap technique, holding the syringe between the thumb and forefinger as if holding a pen, and pierce the skin quickly and smoothly at 90-degree angle. So, if blood appears in a syringe, withdraw the needle and discard the syringe and prepare for new injection. If blood does not appear, inject the medication steadily and slowly while holding the syringe steady if using the ventrogluteal side. After injection, wait 10 seconds if using the ventrogluteal side and withdraw the needle. Withdraw the needle smoothly and the same angle of insertion and applies gentle pressure at the side with a dry sponge. If not necessary to massage the area at the site of injection. If bleeding occurs, apply pressure with a dry sterile. Prior to the procedure, I will introduce myself to the client and verify the client's identity. So, ma'am, good day. I am Lea Denise D. Diamante, your student nurse from Davao Doctors College. Can you state your name, ma'am? Your date of birth? Okay, thank you. So, after that, we will place or let the patient, after that, we'll position the patient in her or his comfortable position or depending on the site where we are going to perform the procedure. So now we will explain to the client what is the purpose of the medication. So ma'am, I will inject a medication through your body or here in your stomach using insulin syringe because you have a type A diabetes. Is that okay, ma'am? Okay. Select and clean the site. Select a site free from tenderness, hardness, swelling, scarring, itching, and burning, and localized inflammation. Select a site that has not been used frequently. So, I will apply clean gloves and clean the site with an antiseptic swab. Start at the center at the site and clean and widening circle to about 5 cm. Allow the area to dry thoroughly. Remove the needle while waiting for the antiseptic to dry. Inject the medication. Grasp the syringe in your dominant hand by holding it between the thumb and fingers, with palm facing the side or upward for a 45-degree angle insertion, and prepare to inject. Using the non-dominant hand, pinch or spread the skin at the side and insert the needle using the dominant hand and a firm, steady push. So after that, remove the needles smoothly, pulling along the line of insertion while depressing the skin with your non-dominant hand. If bleeding occurs, apply pressure to the site with dry sterile gauge until it stops. Dispose of supply appropriately. Assess the patient to the comfortable position. Flip down the medication ticket if not using or EMR. Do the aftercare, remove the gloves. Dispose used items in appropriate waste receptacle, return other equipment to the perform hand hygiene. after that, document all the relevant information, the dose, the site of the medication, and the time that you inserted the medication.